For as long as psoriasis has been around, psoriasis sufferers knew that sunlight often lessened or made the scaly patches go away for a period of time. In the 1970s, doctors developed the first modern type of ultraviolet phototherapy using drugs in conjunction with UVA light. It worked really well, but it wasn't perfect. It wasn't until the 1990s that narrowband UVB became a common treatment for many photoresponsive dermatoses, which meant not just psoriasis could be treated, but also vitiligo, eczema, and other things as well. Meet Sam. Sam is one of 9.7 million people in the United States with psoriasis. That's approximately 3% of the US population. Sam's skin cells reproduce 4 times their normal speed in certain areas of his body. That leads to some pretty itchy and uncomfortable plaque buildup. Over the centuries, doctors have tried lots of methods to treat folks like Sam. But Sam isn't alone. Another 1% of the population suffers from vitiligo, and an additional 10% have eczema. In vitiligo, melanocytes stop producing pigment, which creates white patches of skin. Dry, red, itchy, and rough skin areas are commonly diagnosed as eczema. Even though these diseases are quite different, they have something in common. They can all be treated with light. How does it work, you ask? Good question. The naked eye can see this much of the electromagnetic spectrum, but this much actually exists. Inside of this giant range of waves are things like microwaves, radio waves, X-rays, and ultraviolet waves. Inside this group of UV light exists this little band of waves called narrowband UVB. The diseased skin is exposed to this special type of light by using a medical device called a phototherapy unit. It uses a special type of light bulb that emits narrowband light. When it penetrates the skin, one of the ways the light works is by altering the expression of Th17 helper cells. These cells, when overactivated, lead to inflammation and exacerbate certain autoimmune disorders. A course of phototherapy consists of regular treatments over several months for most diseases. Most of the time, people achieve best results when they treat about 3 times a week. When treated with narrowband UVB, 80% of psoriasis patients get 80% clear in about 25 treatments. Here's how narrowband UVB compares against other treatment options for psoriasis. When we compare the results of using narrowband UVB on other diseases like vitiligo and eczema, the results continue to be impressive. Phototherapy is also very safe, especially when compared to other treatments, which can have lots of side effects. So, what do you think so far? Sounds good, right? Sam can either be treated on an outpatient basis in your office or in a phototherapy clinic, or you can prescribe him his own personal phototherapy unit to use at home under your instruction. Both in-office and home phototherapy have been proven to work equally well. Dosage is really about delivering a certain number of light particles, photons, to the skin at a certain rate. A patient's erythemal tolerance determines how much light can be given at a time. If the dose is too large, patients will experience erythema. If the dose is too small, the skin will just become accustomed to it, and the patient won't get clear. This is called photoadaptation. Sorry about that, Sam. Okay, here we go. Sam is a typical patient, so we know that he will need about 1200 millijoules delivered at 5 milliwatts of power over the course of approximately 240 seconds. At this rate, we see that the… Wait a minute, wouldn't it be nice if we just did the work for you? We agree, so check this out. Introducing ClearLink. ClearLink is Daavlin's exclusive online prescribing tool. It allows you to write your patient's phototherapy prescription instantly on your smartphone, tablet, or computer. It even generates a letter of medical necessity for your patient's insurance company. With ClearLink, you can view all of your patient's information, create and save custom protocols, or select from recommended ones. Print or email treatment instructions for your patients at the click of a button. ClearLink gives you more access and control than any other home phototherapy program in the industry. Setting up your ClearLink account only takes a few minutes. You can add your staff as authorized users as well. You'll be able to see the status of your patient's Daavlin phototherapy order, refill their FlexRx exposures, and receive messages from the Daavlin team. ClearLink is highly secure and HIPAA compliant, and has an efficient and intuitive user interface. It also, sorry for going on like that. You will just need to see it to believe it. Thanks, Sam, and thank you for watching.